Hey guys, welcome back to my channel. My name is Adiamond, and in this video we're going to be talking about all things pilonidal cyst. I am so sorry that you're here. If you're watching this video, you probably have pilonidal cyst. You may be watching this as a follow-up to the video that I did 3 years ago, and as of October 26th was actually my 3-year pilonidal cyst surgery removal. I know, it's just give it up, right? So today I wanted to sit down and answer some of the questions and kind of just elaborate on what, my experience, what the, couple years following up have looked like and everything like that. So if that sounds any bit of interesting to you, stay tuned. First, I just want to say there is so much uncertainty revolving the pilonidal cyst, and that's really why I felt like it was my due diligence as a survivor to have that conversation and share that video with you guys. And so I decided that I was going to call my doctor's office and try to get some more answers, try to get some more details, and that didn't really go as planned. My name is Adiamond Starks. I was actually a patient of Dr. Joe Johnston's about 3 years ago. He actually removed a pilonidal cyst on me, and I was just wondering where could I get some information about the procedure, what was done, and just those sort of details. So these are all the details Julia gave me. Not a lot, but the procedure was a local and advanced flap closure. That's the type of closure that Dr. Johnston performed on me. She also told me that my incision was about 36 centimeters squared. Somebody do that math. I don't know how big that is, but the cyst itself was 4 centimeters, and I think that's like about 1.5 inches. So here's what my cyst looked like. Someone says it looks like a piece of ravioli. Absolutely disgusting. I know. Okay, so let's go ahead and kind of discuss my follow-up. A lot of follow-up questions from my procedure. So you guys are asking about pain. A lot of you want to know, was it painful, wasn't painful? And my experience was not recovering, not anytime after. I kind of remember this very brief period for maybe a couple days. I was doing a lot of lower body exercises, and I started just to kind of feel like a weird kind of like, just like my nerve felt weird. It didn't like hurt. It wasn't comfortable. Another thing that you guys wanted to know was my scarring, what that looked like. If you could just imagine like a scar going straight down my butt crack, that's essentially what it was. For my procedure, I actually also had a tube, a drain. I had a drain, and I had to keep that drain in until like my drainage was, so many ounces following up from the day of my procedure. So I believe it was like maybe after 7 days I was able to get that drain removed. And of course it's not the most comfortable thing. I remember like I just got so sick and tired of being at home, and there was like a fall festival going on. I literally like went to that. I just tucked the little, it looks like a little grenade. I literally tucked it down the side of my pants. I had to be really careful like standing up and down because you could yank it out, probably. I don't know. And of course, like there was actually like that was legit in my butt cheeks, and so they just pulled that out. It felt pressure coming out. It wasn't painful, and that was really that. I would say if you haven't watched my previous video, definitely do so, because I probably do address a lot of questions that I may not in this video, such as did I have, was my incision packed and things like that, and it wasn't. That was not my experience, and I did have a flap closure, and I, the site was stitched up and stitches removed and everything healed great. So I'm very, very, very thankful for that. So talking about the complexity of the pilonidal cyst in and of itself is really tricky, and my heart really breaks. There's tons and tons and tons of comments from 3 years ago to past couple of weeks, and that's why I wanted to do this video, because so many of you guys are out struggling. So let's kind of talk about treatment. What is it, how to go about it, how to navigate potentially getting this removed. So my experience is that I had my pilonidal cyst for probably 4 or 5 years, and I know that sounds like a very long time, but you have to understand the nature of these cysts. They go and they come, or at least mine did. So it would flare up for maybe 2 weeks, and then I would be like, oh my God, I'm healed. And then like 3 months later, it flares up and it's the worst thing ever. And then it would stop. So after I kind of kept having this reoccurring, flare up, I was just like, all right, I'm sick of this. I'm gonna get this taken care of. And so, as I mentioned in my first video, there are people that I've spoken with who had a flare up. They're like, hey, I felt something, arise on my tailbone, but it only happened one time. And if that's your situation, I really would not be too concerned. Like, maybe let's say this happened like 3 years ago, you've never had an issue with your cyst since then, I really wouldn't worry about it. But if it's a reoccurring issue, one, especially if you're active, if you're a young person, because you're in school and you sit down a lot, and maybe you're active and maybe you're in sports and other, extracurricular activities, and it really diminishes your quality of life. Because you cannot do all the things that you could do if you had the cyst. For example, I could not work out for many periods of time, even though I want to so bad, because every single time that I sweat, it didn't matter if I took a shower immediately afterwards, that cyst would flare up. Because what happens is the pilonidal cyst has these little, kind of like they're holes. And what happens is dirt and debris and sweat gets trapped up in those holes, and they create this sack of pus and of blood and of tissue and hair, and it's disgusting. It's really disgusting. And so if this has been your experience, especially like reoccurring, antibiotics are great, but there's only so much you can do. You can only be on antibiotics so long, and just being on and off of them is not the healthiest thing. And when my pilonidal cyst was the worst it ever was, I was like sick. Like, I feel like I had like cold sweats because my body was trying to fight an infection, and you just don't want that for the rest of your life. So if you are, one who kind of has this reoccurring pilonidal cyst issue, I would highly suggest finding a surgeon who's comfortable and confident that they can remove this cyst for you. And I know that that's tricky because a lot of surgeons are not, just because the success rate of them, one, either coming back, which mine did not, or two, just you recovering, and the site healing properly, that success rate is not very high. I know that's discouraging, but one thing that I would say, if you are considering getting your pilonidal cyst removed, do not, and I mean do not, listen, don't do it. Do not, please do not search on Google and YouTube the videos and the photos and the surgeries, because they're legitimately horrifying. Like freaking Halloween, like trick or treat, like they're scary. And here's the deal. If you know your cyst doesn't look like, if it's not the size of a golf ball, you're not gonna have a size of a golf ball incision. You're not gonna so, and unfortunately, like if yours is that big, which I don't really know, I mean, I guess it could be, I don't know. All I'm saying is most of those graphics, and I've gone through many of the photos on Google, and I'm just like, these are literally the worst of the worst cases. Potentially, maybe not even the United States, maybe third world countries where they can't get access to proper treatments and surgeries and things like that. So as far as just treating your pilonidal cyst, maybe you can't get surgery right away, or maybe you're just trying to do everything you can to keep that site clean. The biggest thing is to keep it clean. Is to keep it clean, and if you're hairy like me, keep it shaved. So I would certainly kind of keep it as clean as possible. Unfortunately, like I said, anytime I worked out, made my cyst a lot more active, flared up. So if you can avoid physical activity, I would just do it. Maybe take some really, low intensity walks or something of that nature. And maybe that's not your problem, but that I can definitely say that, anytime I worked out, my cyst would flare up. Also, those like rails in the elevator, stay the heck away from those things. Like every single time, even if like every single time I hit one of those, I'd have a flare up. And it's very, very painful. And at the moment you hit it, it's like, I just did myself in. So a couple of comments that I saw for people who had, maybe it's like some home remedies, where like, I know personally someone reached out to me and told me to try like melaleuca and oregano. That didn't really do anything for me. I saw some people in comments say they did like just Irish Spring soap and they clean with that anytime they have a flare up. And I also saw something like fenugreek pills or fenugreek supplements. Personally, if you feel that you know, that helps. Hey, do your research and maybe you can find something that works. I think everyone's cyst is different, and so that's fine. But if you have reached like, I'm so sick and tired of this thing always flaring up, like just spare yourself the pain and go get it removed. So there's one lady in the comment says, I found out a brief ointment and tea tree oil works really well. I've been using it for 30 years. Also, if you avoid chocolate and nuts, that really helped me. I don't get many outbreaks when I avoid chocolate. Another thing I use to treat the pain is lidocaine 5% ointment from my doctor. Use it when it's really bad. So I don't know. I've never made the association between chocolate, but hey, maybe, you know, why not try? Let's talk about lancing, because I see that was a lot of you all's situation. You've done lancing, and I actually had my lance when my cyst was at its worst, and it like basically ruptured. I was doing a hot soak, guys. That's a really great thing. Some Epsom salt baths, that definitely helps a lot. Just, you know, if you're needing just some immediate relief. So when my cyst was the worst I was actually bedridden for like 3 weeks. I couldn't do anything. I couldn't walk the stairs. I couldn't do anything. I literally laid on my stomach or my side for 3 weeks. No exaggeration. And so how that cyst actually ended up, you know, resolving itself was, I was sitting in a very, very, very hot bath. And so it just kind of like ruptured on its own. And I was just like, ew. Number one, it smelled absolutely nasty. And it was gross. And there was tons of pus and everything like that. So my mom, thanks mom guys, my story is hilarious. I was home by myself. I was in so much pain. Yet I'm having like blood and pus come out my tailbone and out of this cyst, and the only person home is my little brother. So I had to call my brother to help me get situated, get me a towel. It was just literally the most hilarious thing and so terrifying for my brother at the same time. And it literally smelled like death. I'm not even gonna, it was so smelly. I think that is pretty much it, guys. That's my story, that's my experience. If you've had your cysts removed, let me know where you are in your healing process. If you are thinking about getting removed, let me know. If you have any questions, feel free. I'm gonna do my best to respond to all of you guys' comments, because I know like this is like really important, and us Pilonidal people have to stick together once again. So I hope that you guys enjoyed this and that I answered all of your questions. Feel free to hit me up again on Instagram or something if you want to just reach out to me and see maybe if I have any other advice for you. So that is all, guys, and I hope that you all have enjoyed this. Thank you for checking out this video, and I'll see you on the next one. Bye.